With that, I'd like to welcome to all of you, Dr. Donna Carey.
Thank you, Anna. So great to be here. So thank you, everyone. I'm really happy to be here and always honored to be able to provide information to anyone regarding how we communicate about vaccines and with our communities who, for various reasons, have questions and are not as trustful around anything new actually that comes into our communities. And so I'm going to start, and my first slide is this dual picture of communication boxes, and that's because our communication is both ways, right? It's a two-way communication, and as providers, particularly us as clinical providers, clinicians, we often like to talk at folks instead of making it a mutual communication. I talk and then I listen. And so today, I really want to emphasize and encourage something that I'm sure that most of you already do, which is to talk and then give space for listening to our clients or patients. I'm going to just do a really quick overview of the vaccines that we have available. So we have Pfizer, which is the mRNA vaccine. It's 2 doses. It's available now for ages 6 months and older. We have a bivalent booster that, as of a couple of weeks ago, is available for ages 5 years and older, and that's regardless of immune status. So if someone who has a weakened immune system, they're still able to get the bivalent booster. Moderna, which is also the second mRNA vaccine, is also 2 doses. It's available for ages 6 months and older. There's a bivalent booster available, and it's available for ages 6 and older for Moderna. And again, regardless of the person's immune status. And then there's a vaccine that we don't often hear about as an option for those who may not want to get an mRNA vaccine, and that is the Novavax vaccine, which is a protein subunit vaccine, very similar to our hepatitis B, our diphtheria, tetanus, and pertussis, our HPV, and our shingles vaccines. They're all protein subunits, still 2 doses. It's available only for ages 12 and up. And just about 2 weeks ago was also approved to be used as a booster, but you can only use it as a booster if you've never received a booster previously. So if you had a booster with Pfizer or Moderna, you could not get a booster for Novavax. And then finally, there is a fourth vaccine, which we don't recommend. It is a viral vector vaccine, and it is the Johnson & Johnson vaccine. And because of the issues with having blood clots as a significant risk factor, that vaccine is not really recommended, particularly because we have 3 really good, effective vaccines. There is no reason why we should use a vaccine that has such a significant side effect as blood clots when we have other options. I want to talk about sort of where we have been in this pandemic and the variants for coronavirus that have been present. And this is leading into why so many boosters and why this new bivalent booster. So if we look at the beginning of our pandemic, and the purple line is the alpha variant. That is the original kind of Omicron strain. And then you can see sort of in the early spring, we saw a jump of the blue line, which was the Delta variant. And the Delta variant kind of came and sort of took over. And when the initial vaccines were available, there was concern that because the vaccines were created during the alpha phase of the coronavirus, whether or not those initial vaccines would cover us when we had the Delta variant. Well, we found that it did, those vaccines did. And then the Delta variant died out, and what became more prominent and remains our predominant variant, which accounts for about 99.9% of our coronavirus infections, is the green, which is the Omicron variant. And so our vaccine makers went back and said, well, let's try to create a vaccine that covers not only the original strains, which means that it covers the alpha and the delta, but also covers the most predominant strain now, which is the Omicron BA.4 and BA.5. And so the new bivalent booster shot is really covering two different strains, the original strain and the Omicron strain. And those are the Pfizer and the Moderna options. Both have this bivalent booster. You can take this bivalent booster if you have more than 2 months since your primary series or any other booster. And I can tell you that I was blessed to just get it last week. And I found that the side effects actually were less with this booster shot than I had with my initial 2 booster shots that I had with Moderna and with Pfizer. And so I think that because our bodies are used to it and because our bodies now know what to do, that I feel like I got less of an immune response in terms of my side effects than I did initially. If you have had COVID in the last, if you're currently just getting over a COVID infection or had COVID about a month ago, the recommendation is that you wait somewhere between 2 to 3 months because you have such great natural immunity from having COVID. It's that you would wait 2 to 3 months before you get the bivalent booster. And if you just received another booster, right, the mono strain booster, that you should wait again a couple of months before you get the bivalent booster. But I do recommend that you do get the bivalent booster because that initial primary booster does not cover Omicron. And so when we're talking about communities of color and we're doing all of this extra training, we're lots of conversations that we've had since the beginning of this pandemic. We had vaccine sites that were really made to make sure that they were in communities of color. Why all of this extra effort? And so I get this question quite a bit from my colleagues, from other people who are in other communities that are not of color. And so I wanted to just take a moment to talk about why the importance of this extra effort. And I relate it to myself as a pediatrician. As a pediatrician, we figured out that when we wear our white coats, we walk into the room, and it doesn't matter how big I smile, how many toys I have on my stethoscope, or what distraction techniques that I provide to the kid. As soon as I walk in the room with my white coat on, the kids are complete panic. They're crying, they're clinging to their parents, and it's really difficult to get anything done. And so, as a pediatrician, we learned as a profession that if we want to provide to get trust from those kids so that they don't know what's coming, then we should take off the white coat, right? Because the white coat is just a sign of anxiety, right? It's just it signals for them to be anxious. And so we as a profession decided to remove our white coat because it's our job to make sure that we are meeting our client or our patient where they are, and that it is our job to provide to make sure that they are comfortable and that they can then trust us. And it's very similar when we talk about communities of color. It is our job as the providers that we provide what is necessary to make the communities trust us. That onus is on us, not on the communities. And so the extra effort for communities of color is because of the longstanding history of racial and the systemic racism in our country. And so we have to provide this extra effort. We also need to provide this extra effort because we're not doing well in communities of color around vaccinations. And so not only are we looking for race, ethnicity, and how well we're doing, but even by age, right? And so now that we have these vaccines available for our younger kids, we're looking at how are we doing with our vaccinations. And I'm sorry if it's really small, you're not able to see, but if you look at our kids who are ages 6 months to 4 years old, only about 17% are fully vaccinated. That means 2 doses of their vaccine. So our youngest, our most vulnerable, are the least vaccinated. Then if we look at our 5 to 11-year-olds, they are about 65% are fully vaccinated. And it gets better as they get a little bit older. Our 12 to 15-year-olds, about 85%. And then when we get above 18, we're about 88% or higher, excuse me, in terms of being fully vaccinated, which is great, right? Because that means that the vaccine is, people are getting more comfortable with it. But even within that ages, we see there is disparities within, and when we look at the ethnic groups. So if you look at the lowest ethnic group that has the lowest rate of vaccination is the African Americans. So only about 70% are fully vaccinated. Then we have the Hispanic Latino community, which is about 72% vaccinated. And our, Asian Pacific Islander community also in the high 70s, whereas we have like 90% or higher in our Asian communities. And again, we know that this is not completely disaggregated data. So which is it, all Asian communities or just some Asian communities? But overall, in the data that we have, they're about 92% vaccinated. And so there's discrepancy and disparities in our vaccinations in terms of racial and ethnic group, as well as in terms of our ages. And we hopefully today can get empowered to do something about that. There's this book called Medical Apartheid, and this again speaks to why we're doing this extra effort. There's a quote from a page in this book by the author Harriet Washington, and it says, "The experimental exploitation of African Americans is not an issue of the last decade or even the past few decades. Dangerous, involuntary, and non-therapeutic experimentation upon African Americans has been practiced widely and documented extensively, at least since the 18th century." And so when you think about why the extra effort, and you think about, well, what is it that is potentially hindering our communities of color to actually get vaccinated, then you think about that quote, right? You think about the fact that for centuries, the medical and the scientific community has not done right by African Americans or other communities of color. And so there's this term that was kind of out there during the pandemic, and we were talking about why people were not getting vaccinated. Why does it remain so low in the African American community in terms of being vaccinated? And there was a phrase, there was a word that I called hesitancy, and that was just kind of floated around. Everyone was talking about hesitancy, and it just made me cringe, because I think that phrasing of hesitancy, even though, and as I'll show in a little bit, that it was not just in communities of color that there was hesitancy, but that word stuck, particularly in the African American community. So even as we were attempting to help people, we were placing sort of a racial overtone onto why people were not getting vaccinated. And so instead of saying hesitancy, thinking about historically, I called it justified distrust. I think it's wise when you have this history that where in your community there has been misuse and abuse of your community, that when you have a brand new vaccine, a brand new virus, and brand new technology of this vaccine, that it makes sense that you would be questioning of it. And so I developed something called the 4 A's of justified distrust. And it is to acknowledge, ask, address, and advocate. And it's in a circular fashion, and to look at it like an onion, because you're going to have to probably repeat this cycle multiple times. Their first time that you speak to someone, you might be able to go all the way through, the 4 A's, and you still may not get the answer that you're looking for, or the answer that is best for that particular member or their family. And so you might have to start over. And so it's like unpeeling an onion. It's taking the time and the effort and the energy to continue to go through this cycle until you actually get to the point where someone may do something that they did not want to do, but is actually the best for them. So let's go through the 4 A's. The first A is to acknowledge, and that started there with, just talking about that quote from the book. But I think it's important that you demonstrate that you are aware, that you understand, and you empathize with the centuries of medical and scientific abuse upon the Black diaspora and communities of color. It's not just the syphilis Tuskegee experiment. It's things like the father of modern GYN, right? James Sims, who did all of this experimentation without
Oh,
anesthesia on Black
God.
slave
Oh,
women.
oh,
Yeah, I'm not sure who
right.
that is, but it was terrible. And then we think about Henrietta
Ugh,
Lacks, who
ugh.
is the first immortal human cell line. Almost every sort of technology and
Oh,
advancement
yeah.
that we have because of the HeLa cells, or those cells
Mhm.
that were taken from her without her knowledge, without her consent. And we continue to use it in science even to this day. And so being aware of those things and understanding and empathizing why someone might have a raised eyebrow around this new technology and this new vaccine in this era. We also should acknowledge that the privilege of automatic trust that comes with being a physician, or comes with being someone who works in public health, that automatic trust is lost, right? We really don't have that privilege any longer. And it's because of this abuse that has been going on in our communities for so long. There was a poll by the Kaiser Family Foundation, and Undefeated, which is like a talk show on ESPN. And they asked how many people think that the healthcare system treats people unfairly based on race. Okay, so that was the question. Do you think that the healthcare system treats people unfairly based on race? 70% of Blacks who completed this poll said yes. And this is compared to 41% of whites who completed the survey, and 42% of Hispanic Latinos who completed the survey. So that says that nearly 50% of all races recognize that the healthcare system treats people unfairly based on race. But it is more prominent in the Black community because more often than not, it is in our community. We also need to acknowledge the confusing messages around the virus and the vaccines. Acknowledge that there has been 1 week we should do this, the next week we should not do this. And so there's a lot of messages that were confusing. We didn't know a lot about the virus in terms of the way it presented itself, right? We knew a lot about its cousin, which is our regular old run-of-the-mill cold virus, but we didn't know about this. I call this virus the ratchet cousin of the cold virus. So we didn't know it was unpredictable. We had no idea what it was that we were facing. And so we have to acknowledge that we were confused as healthcare providers. And we have to acknowledge our own concerns around the vaccine. And it's okay that you have those concerns. But acknowledging that even I, as a physician, was really concerned about the vaccine. And I was concerned about how quickly we developed the vaccine. Until I did my own research for myself, then I became a lot more comfortable. So with our vaccine introduction, there were the 3 new things, right? I already mentioned. It was a brand new virus to most people. It was a brand new vaccine that was developed, and we hadn't had a vaccine developed in probably a decade. And it was using brand new technology that to the majority of people never even knew that mRNA technology existed for vaccines. It was used in very few cases in some sort of autoimmune diseases, but to the broad public, no one knew about these things. So we had three new things that were being introduced at the same time in a very non-trusting, I would say, way in which it was early messaging, right? We had things like the administration was talking about Operation Warp Speed. Probably not the best term to use when you're trying to get people to trust something, to say that warp speed kind of insinuated that perhaps steps were skipped in terms of making this new vaccine, where it actually wasn't that steps were skipped, but it was because this was a worldwide pandemic, we were able to do steps simultaneously. And that's what allowed us to get the vaccine developed so quickly, because we didn't have to wait for the money to come in to go from step one to step two, but we could do the steps at the same time because there was really such world cooperation and world financing that we were able to develop this vaccine so quickly. And then obviously in the very beginning with the Trump administration, we were politicizing what was clearly a public health crisis, and it had nothing to do with politics, but it became very politicized. There was widespread concern about the vaccine introduction. There was a survey of the American Nurses Foundation, and about only 14% of these nurses who were surveyed said that they were very confident about the vaccine development. And only 15% were very confident about the vaccine safety. So again, even in the medical community, there was not a lot of confidence around this vaccine. And in that same Kaiser Family Foundation poll that I mentioned earlier, when they asked what were the main reasons for people not getting the vaccine, safety concerns was the #1 reason. And 39% of Blacks and 30% of whites were concerned about safety. And then lack of trust. 35% of Blacks polled did not trust what was happening, whereas there was 23% in the white community did not trust. And so again, we were seeing a difference in our perception about the vaccine introduction based upon race. And then I already discussed the fact that I hate the word hesitancy, and because I thought that I still do think that it perpetuates this racist language as if the only people who are hesitant were people in the Black community, when clearly from these surveys and polls, we see that it was actually widespread in every race and even in amongst communities who were in the healthcare profession. So that's the acknowledging. That's the first A, is like acknowledging all of that, everything we just talked about. Acknowledging there is racism within our systems, racism in healthcare, and acknowledging how that can play into your decision to take a vaccine. The second A is to ask, and this is to ask your patients about their concerns. What are they concerned about? Don't assume that you know what they're concerned about. And a mistake that I made early on was that when people would say they didn't want the vaccine, I would immediately start talking about the science of the vaccine. I immediately started talking and dispelling myths about the science, about how it was developed, and that just really was not what people were concerned about. They were not concerned about the science. They just wanted to know the bottom line. Hey, is it safe, and what's in this vaccine? what's in it? What the heck is mRNA technology? And so really asking instead of assuming. And if the person doesn't offer immediate questions, or maybe they're concerned, maybe they're not quite sure, maybe they don't want to be judged by what they might be concerned about, you can start to offer things that you've heard from, patients or clients, or maybe that you've thought about even yourself. And so we saw that a lot of our folks were concerned about pretty much the same thing: the safety of it, do they trust it, what's kind of in it. And so the third A is addressing. So directly answering questions and answering them honestly. If you don't know the answer, admit it, get some research, ask someone else, and then get back to them with an answer. One of the things that cropped up and developed in our pandemic, because everyone was sitting at home, is that everyone became an expert, and without any credentials and without really any criteria for what created an expert. And so there were plenty of people who were offering information on YouTube and Facebook and Instagram, all social media, about things that, and it was not true. They were perpetuating myths, perpetuating falsehoods. And so really important that what we give as the professionals, the answers that we give and the information that we give has to be accurate. And so it's important that if we don't know the answer, instead of making it up and then they go somewhere and find out that what you said is not true, then that is going to lessen your ability to communicate in a trustful manner. And then Georges Benjamin, who's executive director of the American Public Health Association, talks about talking at a kitchen table level, right? So having conversations with people as if you're sitting around the kitchen table having, a piece of pecan pie, which is my favorite pie, and some tea. So really not talking above them, not using scientific language, but really talking as if you're talking to a friend around a kitchen table. It's important that we make the conversations and the language that we use, that we make it our own, but that we try to kind of stay away from some trigger words, words that might cause people to shut down before you even get an opportunity to talk to them. It also is some words that are triggers for mistrust and myths that are out there in the community. So instead of saying things like injection or shot or jab, which is also, very triggering for people who may not like needles, they don't want to hear that they're going to get jabbed, is to just say vaccination. And instead of talking about that the vaccine was developed quickly, you can say that it is still an effective vaccine. I do, however, discuss the rapidity of with how we created the vaccine. And I discuss it in the way that I just did, in terms of not skipping steps, but being able to do steps at the same time. Also, staying away from things like Operation Warp Speed, or that this is an emergency use authorization, right? But I do think that it's important that we recognize what is fully FDA approved, because again, this is transparency, and this is being honest with people. What most of our vaccines, actually, I think all of our vaccines now are fully FDA approved and not under emergency use authorization. Saying things like we're getting the latest information versus saying there are things we still don't know. And I would say that you can use, to me, I do say that there are things that we don't have all of the information. But I think it's okay to admit that we don't have all of the answers, but that we do have, this is the latest information, and these are the things that we do know. In terms of why people may want to get vaccinated, and we want to believe that we're a very altruistic people. And so we want to believe that if we say this keeps your country safe, that might encourage people to get vaccinated. But at our site where we did our vaccination clinics, I did a survey of those who came and got vaccinated. And the number one reason why people were coming in to get vaccinated was not to keep their country safe. It was to keep their families safe, to keep their loved ones safe. And so I think it's important to recognize what it is that's moving people. Trying to stay away from the government, right? Because that kind of leads into all of the conspiracy theorists that are out there. Excuse me, but really saying that this is a public health issue. And saying health and medical experts and doctors versus scientists, because again, that word scientist is sort of a trigger for a lot of the conspiracy theorists. And then I say try to stay away from words that are very judgmental. So again, hesitant to me is very judgmental, being skeptical, being an anti-vaxxer. Those are words that are charged and that are very judgmental. And so instead of labeling people, just understanding that we expect people to have questions. And then I think it's important to address some of the common concerns. So we know vaccine safety is a common concern, especially as we can see from the low rate of vaccines for our kids, that parents are very concerned about their babies 4 and under getting this vaccine. And that's really important to understand, especially since that's the age group who is getting the most vaccines, right? From the age of birth to the age of 1 year, you're getting vaccines almost every 2 months. And that's the age group that the parents are not getting this vaccine. So why is that? Why is that? Addressing side effects and effectiveness, addressing the long-term impact of the vaccine. People are worried about, does it cause autism? Is it going to stunt the growth or the development of my child? Multiple doses, are we still going to, do my kids have to get multiple doses just like I did? Are they going to have multiple boosters? And, you know, the concern of, well, I got vaccinated and still got COVID, or I know my friend or a cousin or a family member who got vaccinated and still got COVID, and addressing that that's not the reason for the vaccine. That is not the goal of the vaccine, is to prevent people from getting COVID. The vaccine was developed to prevent people from getting extremely ill and being hospitalized and dying from COVID. But never have we built the COVID vaccine, or I should say we have not built, because there were a lot of people who were billing the vaccine as, you know, if you get this vaccine, you won't get COVID, which was a poor message on behalf of many, many health professionals even. But understanding for you all as you're talking to clients that that was not the goal of the development of the vaccine. The goal of the vaccine was to prevent illness to the point of hospitalization and death. So let's look at some of the common concerns, and that is the content of the mRNA vaccines. A lot of people were concerned about what's in this mRNA vaccine. What the heck are all of these things that are in it? And, you know, the vaccine developers did an excellent job of developing a pretty clean vaccine. It does not have a lot of ingredients in it, and it does not tend to cause many allergies to the components of the vaccine, because there's not a lot of things in it. So what's in the mRNA vaccines, and again, this is the Pfizer and the Moderna vaccines, is mRNA, right? And so we need to have the mRNA in there because that's what goes into the body to tell your immune system to start to encode for this viral spike protein that sits on the actual virus, right? So it kind of replicates what is on the actual virus without you getting infected. There's fat or lipids, and that's because we needed something to carry that mRNA into the cells. And our cells have fat, you put it into fat and your body won't reject it. There's also salt and sugar in the vaccine, and that is to kind of help to keep the vaccine stable. As you are manufacturing it, then you freeze it and you're shipping it and then you're storing it as you're waiting to give the vaccine, you have to have some stabilizers in there. And the Moderna vaccine, between the Pfizer and the Moderna vaccine is the only vaccine that actually has acid in addition to the salt and sugar to help stabilize. And that acid is like our table vinegar. What vaccines do not contain, and I think this is important because lots of people, I'm sure you all, like I have heard lots of things that are in the vaccine, but the vaccines do not contain eggs or preservatives or latex or metals. It does not contain fetal tissue. We heard this a lot in the very beginning. We also heard microchips, so it does not contain any microchips. It does not contain anything that's going to create a magnetic field in you or make you more magnetic. It's not going to do any of those things because none of those things are actually in the vaccine. So it's important for us to be knowledgeable so that we can have conversations around the myths that are floating in the community. Side effects. So a lot of people talk about side effects, and I'm just say, as a physician, as a mom, I tell you the truth. If you ask me if it's going to hurt and it does hurt, I'm going to tell you that it hurts. And I think that's the way in which we should approach all things, is with honesty. Yes, it's going to hurt, but it's going to hurt very minimally and very quickly. And yes, you might get sore, but that soreness will go away after a couple of days. Some of the other common side effects, you might get a fever, you might get a headache, you might feel super tired and drained, or get chills or pain at the vaccine site. You might get muscle or joint pain, nausea or dizziness. We know that there are some side effects where you're actually, based on the side that you get the vaccine, your lymph nodes might enlarge. And so, yes, these are common side effects. And usually when I get my booster shots, I get all of these, right? I have a fever, a headache, I get chills, I'm wiped out, tired for a couple of days, pain at my injection site. But there's things that we can do to sort of help offset some of these side effects. And the side effects are good. It means that your body is doing what it's supposed to do, that the immune system has seen that viral spike protein, that it's starting to sort of rev up. I call it our army. Our immune system is our army. So it's building up the Army, Navy, Air Force, Marines. All of them are coming to our defense so that if we actually see the enemy, which is coronavirus, your defense system is ready. It's armed and ready to start attacking that enemy before you get super ill, so that you can prevent being in the hospital or prevent you from dying. So there's a lot of questions around clinical trials, especially around the kids, like, well, who were these kids? How many kids? How many people were actually tested before you rolled out these vaccines? And so in our Pfizer clinical trial, there were about 1,200 kids between the ages of 6 months and 23 months, and then another 1,800 kids in the 2 years, so I should say 2 years to 4+ years. And then 5 years to 11 years, there were 3,100 kids. And then over the age of 12, there were 23,000 individuals. Now, that's just the clinical trial. Now, since we've had these vaccines available for over a year, we've had thousands upon thousands upon thousands of people who have received the vaccine. And the good news about these vaccines is that the vaccine that's given to our youngest kids, the babies, is the exact same vaccine that is given to the adults. There's nothing changed in terms of the ingredient, in terms of the vaccine itself. The only difference is the amount. Right. And so that's what they did in the clinical trial for the kids, was to try to tweak to see how little of this vaccine can we give to the kids, but still give them a robust immune response to help prevent them from getting super ill or hospitalized or dying from this virus. And then pretty similarly for the Moderna clinical trial, 6 months to 5 years, over 5,000 kids, 6 years to 11 years, 4,000 kids, and then over the age of 12, over 30,000 individuals, in addition to all of the thousands of people and millions of doses that have been given out. So again, understanding what folks are worried about and addressing them. And so then our final A is to advocate. So we've acknowledged, we've asked what it is that people are concerned about. We have answered those questions, right? So and now we're at the advocate part, right? We want to advocate for people. So encourage them to make the best decision for their family and for themselves. I often, when I'm advocating, I tell my own story. I tell my own story and of the arc of how I came from not really understanding and wanting to get vaccinated all the way to getting vaccinated and triple boosted shots. I talk about the story of my husband who was completely against being vaccinated and would joke and say, I'm going to wait until my wife gets vaccinated and then I'll get vaccinated. And so I tell that story. And I talk about just so many people who we vaccinated at our church site and their arc of understanding and movement towards vaccinating. But it's also important for us to recognize that there are many, many members of our community who are really vulnerable, and that this vaccine has to be given with caution to some of our most vulnerable family members. And we need to understand that and encourage people to make the best decision for themselves. Like I said, at our vaccine site, the majority of the people were getting vaccinated to protect a family member. And it is important to remember that as you're advocating for why we want to give the vaccine. In particular, protecting our children from other family members who are unvaccinated and recognizing that this virus doesn't have an age limit. It infects everyone from birth all the way up until, over 100 years old. I had a baby, a 2-week-old infant, who was uh, infected with coronavirus because the other members of the family had coronavirus. And so it doesn't matter how old you are. If you're alive, then you have to be protected against coronavirus. So why do we really want to vaccinate our kids? Not just why do we really want to protect them? And there's some really good reasons why we want to protect our children. Number one is our multi-inflammatory syndrome in children, or the MIS-C. There is an MIS-A, and that A is for adults. So there's an adult version of this, and it's multi-organ inflammation. So almost every organ in the body gets inflamed. And if your organ gets inflamed, it's not going to work properly. So our heart, lung, kidneys, liver, every sort of organ system gets inflamed and can cause very, very, very ill children. There's been a little less, I think now we're in our 70s of kids who have died from MIS-C because of COVID. And those are 70 kids potentially who could still be here if we could have protected them against coronavirus. Another reason why we want to vaccinate our kids is myocarditis. The American Academy of Pediatrics did a study of 900 hospitals because there's this question of whether or not myocarditis is worse when you have COVID, or worse if you don't get vaccinated or you don't get COVID. So they looked at it across hospitals, and what they found is that kids who have COVID are at a 16 times higher risk. So the risk is 16 times higher of getting myocarditis when your child has COVID. Now, 16 times might be fantastic if you're trying to win, a lotto ticket, you're playing Powerball, you're trying to win, you want an increase of 16 times a higher rate of winning, but you don't want that as a risk for developing something like myocarditis, which is the inflammation of the muscle of the heart. And they found in the same study that if you were over the age of 16 and you got COVID, that the risk of developing myocarditis was 37 times higher with COVID than without. And so while there is a very small risk of developing myocarditis and pericarditis, which is inflammation of the sac around that your heart sits in, when you get the mRNA vaccine, that's a very true risk factor for the vaccine. We know that if you get COVID, that your risk of getting myocarditis is 37 times higher than if you didn't have COVID. So that should be when you're talking about the risks and benefits of a vaccine, and you're saying, if I get myocarditis as a side effect, that risk is extremely low. But if my child gets COVID, that risk is 37 times higher than if they didn't have COVID, that they will develop myocarditis. Another reason why we want to vaccinate our kids is because long COVID exists in our children. There was a study that was done in Italy during the first year of the pandemic, and between the kids between the ages of 6 and 16 who got COVID, more than half of them had at least one symptom for more than 120 days. So imagine these young kids between the ages of 6 and 16 having a headache for 120 days, or having a fever for 120 days, or having a feeling like they're kind of in a fog, right? We kind of talk about this COVID fog for 120 days. And what that does in your developmental ages between 6 and 16, not even really understanding what that is. And that 43% had these symptoms impair their daily activities. So this is when you're supposed to be young and carefree and running around, but 43% of these kids for over 120 days couldn't, because they had some symptom from COVID that impaired their daily activity. There's also a study from the UK that showed kids between the ages of 2 and 11, about 13% of those kids, about almost 15% of the kids ages 12 to 16 still had symptoms of COVID 5 weeks after their infection. That's a long time. You think about these kids who are young, having headaches and having any other symptom that prevents them from really fully living their lives as young, supposedly carefree kids, right? Another reason is hepatitis. So you may have all heard about hepatitis in our inflammatory hepatitis, and these were kids who were around the age of 2 was sort of the peak age. And about 50% of those kids had COVID as the reason why they developed this liver failure that led to liver transplant. And then finally, there's diabetes. So really high risk of developing diabetes with COVID, almost 166% increased risk of developing diabetes if you have COVID than if you do not. And the developing symptom, the presenting symptom, I should say, was that the kid was in DKA, which means that they were severely ill and with elevated sugars over 300. Another reason why is because unvaccinated people are still 5 times more likely to get COVID, 7 times more likely to be hospitalized, and 14 times more likely to die. So that is why we want to encourage vaccines. So your department has some information that you can give to clients that will help to talk about these risk factors and what's safe and effective. So there's the Get the Facts for youth that you have access to, that you can provide to clients. And this talks about how these vaccines are safe for children. And then there's the Get the Facts for pregnancy and fertility, and why it's safe during pregnancy. The number of people in that original clinical trial for the adults got pregnant during the clinical trial. And so they followed those pregnant women and followed those babies to this day, and they all are healthy and developing normally. And then there's this for uninsured families to talk about the fact that you can still get vaccines whether or not you're insured or whether or not you have any documentation. Finally, I just want to encourage you to follow me on my Talking with Dr. Donna. I have lots and lots of videos and information and about COVID. And a lot of people have told clients to, hey, go to this, go to my channel and look up various information and videos on COVID and the vaccines. There's this little QRC code, so you can aim your camera to the QRC code. It takes you directly to my channel. And if you would be so kind to subscribe, I'd really appreciate it. And then that's it. That's my presentation.